If you are a sushi lover, you should watch this.
Tons of sushi and sashimi for years. And when we tested his mercury levels, even on a regular blood test, they were in the occupational hazard.
Hi, my name is Dr. Mark, and I treat skin conditions using Chinese medicine here in Singapore. I'm always learning about new ways to optimize treatment for my patients, and today I am interviewing Dr. Sigrid. Dr. Sigrid is a naturopath, and I'll be asking her all things detox. In this detox series, we'll be covering mercury and psoriasis, mercury and BV or candida, and finally, arsenic and iron deficiency anemia. So let's start with mercury and psoriasis.
This guy with a history of psoriasis, mercury, what was your thought process?
He had significant fungal infections. He had a toenail one that wasn't going away, but also had tinea cruris, like on the groin, right? Despite all the measures, right? Like changing to cotton underwear, managing perspiration.
Studies have found that people with psoriasis are more likely to have fungal infections, and these fungal infections in turn aggravate the psoriasis, causing a vicious cycle. This is why some psoriasis patients also have fungal infections on the toes or in their groin.
It just didn't match this guy's overall picture.
Yes.
So I had one guy who had lived in Japan and had eaten tons of sushi and sashimi for years. And then when he moved to Singapore for his job, he kept going with that. And yeah, when we tested his mercury levels, they were so bad that even on a regular blood test, they were in the occupational hazard. This patient was maybe in his 30s, healthy guy, working out. Chief complaint was psoriasis, and it was actually not terrible. He was managing it quite well. He wasn't immunosuppressed. So then you start thinking fungal overload in the dysbiosis, basically, in the intestinal tract. And this guy had been a sushi lover. So sometimes when people are really prone to fungal infections, like thrush, like athlete's foot, ringworm, it's fine. But if someone really has persistent ones, and that was what's going on with this patient, he had chronic psoriasis and he had significant fungal infections that required oral treatment, which is a pretty strong medication that you have to take for 3 months, and then you have to check your liver during that time.
He has mercury poisoning, which is causing his skin problem. Mercury is a heavy metal which is poisonous to humans. You can get mercury poisoning through air, water, or food. And we know that by eating shellfish or seafood, you can actually get mercury poisoning.
Things we've learned too is that when people have a lot of mercury in the body, one of the things that happens in their gut, there seems to be certain types of fungal organisms that really like this high mercury environment. We thought, okay, look, with your past dietary history and this fungal component, we'll test for mercury. And that came up very significantly.
So to summarize, this guy was eating a lot of Japanese seafood. As a result, he was getting mercury toxicity. Because of his high levels of mercury, he had fungal overload, which was aggravating his psoriasis. This is how mercury is connected to psoriasis. Hope this was useful. And don't forget to catch me and Dr. Sigrid in the next 2 interviews covering mercury and BV candida, and also arsenic and iron deficiency anemia. See you in the next video.